Cardiovascular health in older adults is one of the most important issues that the older adult community in the United States needs to pay attention to, especially when cardiovascular diseases are becoming the leading cause of death in this age group. On the Senior Health YouTube channel, we want to provide a comprehensive, easy-to-understand, and practical perspective on how to protect cardiovascular health, helping seniors live longer, healthier, and enjoy life to the fullest with family and friends. This article will be divided into two main parts, focusing on understanding common cardiovascular problems in older adults in the United States and practical solutions to prevent, manage, and improve quality of life. With the mission of providing reliable and useful information, Senior Health hopes to accompany you on your journey to effective cardiovascular health care. Older Americans, especially those over 65, face a number of cardiovascular risks due to the natural aging process and lifestyle factors common in modern society. One of the most common problems is hypertension, or high blood pressure, which affects more than 60% of older Americans, according to the Centers for Disease Control and Prevention, CDC. High blood pressure is often called the silent killer because it has no obvious symptoms in its early stages, but if left unchecked, it can lead to serious complications such as stroke, heart attack, or heart failure. Causes of high blood pressure in older Americans are often related to age-related hardening of the arteries, a diet high in salt and saturated fat, lack of exercise, and chronic stress. Additionally, obesity, a common health problem in the United States, also contributes to the risk of high blood pressure, especially when older adults fail to maintain a healthy weight or have unhealthy eating habits, such as consuming a lot of processed foods like hamburgers, French fries, or fast food from chain stores. Coronary artery disease is also a major threat to older Americans, with millions of people diagnosed each year. The disease occurs when the arteries supplying blood to the heart become narrowed or blocked by cholesterol plaque, reducing blood flow to the heart muscle. In older adults, the symptoms of coronary artery disease may not be as obvious as in younger people. Instead of severe chest pain, for example, they may just feel tired, short of breath, or have a slight pain in the shoulder or arm. This means the disease is often overlooked until a serious event such as a heart attack occurs. Risk factors for coronary artery disease in older Americans include smoking, a habit that was common in previous generations, as well as high cholesterol levels due to a high-fat, low-fiber diet. In addition, type 2 diabetes, a chronic condition that is on the rise in the United States, also increases the risk of coronary artery disease, especially when older adults do not control their blood sugar well. Heart failure is another heart problem that seniors in the United States need to pay special attention to. This is a condition in which the heart cannot pump blood effectively to meet the body's needs, often occurring after many years of conditions such as high blood pressure, coronary artery disease, or after a heart attack. Heart failure affects more than 6 million people in the United States, and that number is expected to increase as the population ages. Symptoms of heart failure in seniors include shortness of breath, especially when lying down, swelling in the legs or ankles, and persistent fatigue. These symptoms can make it difficult for seniors to do everyday activities, from walking in the park to doing housework. The causes of heart failure in seniors in the United States are often related to a sedentary lifestyle, unhealthy diet, and failure to treat underlying conditions such as high blood pressure or diabetes. Additionally, certain medications such as cancer drugs or non-steroidal anti-inflammatory drugs, NSAIDs, that are commonly used by older adults, can also increase the risk of heart failure if not carefully monitored. Arrhythmia, also known as arrhythmia, is also a common problem among older adults in the United States. This condition occurs when the heart beats abnormally, either too fast, tachycardia, too slow, bradycardia, or irregular. One of the most common types of arrhythmia in older adults is atrial fibrillation, which affects about 9% of people over the age of 65 in the United States. According to the American Heart Association, AHA, atrial fibrillation increases the risk of stroke because blood can pool in the heart, form clots, and travel to the brain. Symptoms of atrial fibrillation in older adults can include a rapid heartbeat, dizziness, fatigue, or sometimes there are no obvious symptoms, making the condition difficult to detect. Risk factors for arrhythmias in older adults in the United States include age, high blood pressure, underlying heart disease, and unhealthy habits, such as drinking too much alcohol or caffeine, which are common in some older adult communities in the United States. Diabetes and high cholesterol are also two important factors affecting the cardiovascular health of older Americans. Type 2 diabetes, which affects more than 25% of older Americans, damages blood vessels and increases the risk of cardiovascular disease. Older adults with diabetes are 2 to 4 times more likely to have a heart attack or stroke than those without the disease. Meanwhile, high cholesterol, often caused by a diet high in saturated and trans fats from foods such as butter, red meat, or fried foods, leads to plaque buildup in the arteries, causing coronary heart disease or stroke. Older Americans, especially those who live in rural areas or have traditional eating habits high in fatty foods, often have difficulty controlling their cholesterol, especially if they do not have access to adequate health education. Stress and psychological issues also play a role in the heart health of older Americans. Many older Americans face loneliness, depression, or anxiety, especially after retirement, the loss of a spouse, or when children leave home. These psychological states can increase blood pressure, heart rate, and levels of stress hormones, like cortisol, all of which put stress on the heart. In the United States, studies show that about 15 to 20% of older Americans suffer from depression, and this condition is often underdiagnosed or undertreated, leading to negative effects on heart health. In addition, lack of social interaction, a common problem among older Americans, can also increase the risk of heart disease because they do not have the opportunity to participate in healthy activities or share their feelings with others. The second part of the article will focus on practical solutions to prevent and manage cardiovascular problems in older Americans, helping them maintain a healthy heart and improve their quality of life. One of the most important steps is to maintain a healthy lifestyle through diet and exercise. Older Americans should adopt a heart-healthy diet, such as the Dietary Approaches to Stop Hypertension diet, which is designed to lower blood pressure and cholesterol. This diet encourages the consumption of vegetables, fruits, whole grains, fish, poultry, and nuts, while limiting salt, saturated fat, and refined sugar. For example, instead of eating a burger from a fast food chain like McDonald's, older adults can prepare a delicious and heart-healthy breakfast of oatmeal, berries, and a handful of walnuts. Additionally, reducing the amount of salt in your diet is important, especially since Americans consume an average of 3,400 milligrams of salt per day, which is much higher than the AHA's recommended 2,300 milligrams. Older adults can replace salt with herbs and spices like oregano, basil, or garlic to add flavor without harming the heart. Regular exercise is also an effective way to protect cardiovascular health in older adults in the United States. However, due to age and other health problems such as arthritis, older adults need to choose gentle and appropriate exercises. Walking is an ideal choice, with a goal of at least 150 minutes of brisk walking per week, according to the AHA. For example, older adults can walk in a nearby park, join a local walking club, or even walk around the mall on bad weather days, an activity that is popular in many areas of the United States. In addition to walking, exercises such as yoga or Tai Chi are also helpful, helping to improve blood circulation, reduce stress, and strengthen muscles, without putting too much pressure on the heart. For older adults with underlying heart disease, they should consult their doctor before starting any exercise program to ensure safety. Weight control and smoking cessation are two other important factors in protecting heart health. Obesity, which affects more than 40% of older Americans, increases the risk of high blood pressure, diabetes, and coronary heart disease. Older adults can start with small changes, such as reducing portion sizes, avoiding late-night snacking, and increasing physical activity. Meanwhile, quitting smoking is an important step in reducing the risk of heart disease, especially for older Americans who have smoked for decades. Quitting programs, such as the 1-800-QUIT-NOW hotline or local support groups, can help older adults overcome the habit. Nicotine replacement therapies, such as nicotine patches or gum, can also help with quitting, but should be used under the guidance of a doctor. Managing underlying conditions such as diabetes and high cholesterol is also important for protecting heart health. Older adults in the United States should have their blood sugar and cholesterol checked regularly and follow their doctor's treatment plan. For example, for diabetes, it's important to keep blood sugar levels stable by eating regular meals, avoiding sweets and refined carbohydrates, and taking medications or insulin as directed. For high cholesterol, medications such as statins are often prescribed to lower LDL bad cholesterol, but older adults should also pay attention to their diet, such as increasing their intake of high-fiber foods like lentils, apples, or avocados. Drinking enough water and limiting alcohol can also help improve heart health, especially since many older adults in the United States tend to drink during holidays or family gatherings. Reducing stress and maintaining mental health are integral parts of protecting heart health in older adults. In the United States, many older adults participate in community activities, such as gardening, joining a book club, or volunteering at local organizations to reduce loneliness and improve mood. Meditation or deep breathing techniques are also effective ways to reduce stress, with many community centers in the United States offering free or low-cost classes for older adults. Additionally, maintaining close relationships with family and friends can provide a sense of security and well-being, which can reduce stress on the heart. For example, attending family dinners on Thanksgiving or Christmas not only makes older adults feel loved, but also encourages them to participate in healthy activities such as walking after meals. Finally, regular checkups and adherence to treatment are key to managing heart health in older adults in the United States. Older adults should have a heart health checkup at least annually, which includes blood pressure readings, blood tests to check cholesterol and blood sugar, and an electrocardiogram (ECG) to detect problems such as arrhythmias early. In the United States, insurance programs such as Medicare often cover these services, making it easier for older adults to access medical care. If they are diagnosed with heart disease, they need to follow their doctor's instructions closely, from taking their medications on time to making lifestyle changes. For example, people with heart failure may need diuretics to reduce swelling, while those with atrial fibrillation may need anticoagulants to prevent stroke. It is important that older adults do not stop taking their medications or change their dosage without their doctor's approval, as this can lead to serious complications. Through this article, Senior Health hopes to bring seniors in the U.S. a comprehensive view of cardiovascular health, from identifying common problems to practical solutions for prevention and management. Cardiovascular health is not only a medical issue, but also the foundation for seniors to live happily, actively, and connected with family and friends. We encourage you to continue following the Senior Health channel to discover more useful information, from physical and mental health to inspirational stories from the senior community. Take care of your heart, because that is the best way to enjoy every precious moment in life.